So one of the commonest reasons men might come to see me to consider surgery is to treat a condition called gynaecomastia. So that's breast development in men. This is something that presents in a number of different ways. So for boys going through puberty, they can develop some firm breast tissue under the nipple, and this can be of various sizes, and if someone's very slim, it leads to projection of the nipple and a little bit of shape in that area. But it can of course be more significant and actually look like a more complete, albeit usually small, breast that's developing. Commonly it's the same on both sides, but it's not uncommon for it to be different on each side. For men who are a little bit heavier, have a little bit of body fat, we get not just gland tissue, but we get an increase in fat tissue in the area over the pectoral muscle. And so we get a more complete and diffuse shape change that can start to look a bit more breast-like. The next group that is commonly seen, and perhaps more commonly seen with bariatric surgery leading to a lot of massive weight loss for patients, is we see men who've now got not only volume, but they've got looseness of the skin, and it is hanging, and the skin is an issue separate to the volume. So in the first group of patients, an incision at the low end of the areola, around the areola, we take out gland tissue under the nipple, and that can lead to a more even shape to the chest, across the chest, without a projection under the nipple. In the patient who's got glandular tissue and fatty tissue, we use a lot of liposuction across the chest. And sometimes that's enough, but other times we also have to do the incision under the nipple to take away the gland tissue that will contribute to an ongoing problem if it's not addressed as well. For the patient where there's skin laxity as well as volume, then there are a bunch of operations that we might consider, with or without movement of the nipple, where we'll take out a lot of skin if necessary, particularly in the massive weight loss group, as well as volume. So liposuction, skin excision, and potentially nipple repositioning are all required for those patients. Less commonly again, there's a fourth group of patients who has a much more significant and much more feminine type of breast develop. And again, utilising similar techniques, we're reducing areola size, tightening the skin, but trying to use approaches that leave us with scars that are as concealed as possible, and managing these in a way that leaves us with a masculine chest and not a feminine chest. So this is a very common operation in our practice, and certainly for a lot of people who are uncertain about what can be done to help, I hope this is useful information.